actually knew right from when I was a student over 20 years ago that this is where I wanted to be teaching post-secondary at some point. I remember sitting in my classes as a student 20 years ago, and classmates would be talking about if they wanted to work in acute care or long-term care, cancer agency. And I remember thinking, you know what? I want to teach. That's exactly what I want to do, is teach someday. So now, over 16 years later, gained a lot of different experiences. And here I am able to teach and share a lot of that experience and knowledge that I've been fortunate enough to gain with my students.
That's
I absolutely love the technology aspect. I love working on the computer. I love Excel, charting, graphing. I love statistics and analysis. I really like epidemiology and the study of the diseases and what's trending, what types of areas we're seeing higher rates of disease. That's one of probably my aspects that I find most interesting in the profession. So the courses range from software application, database training and management, to different ethical classes, as well as anatomy, pathophysiology, physiology, and all the way to data record and privacy management. We look at release of information, privacy obligations, among a vast array of other subjects. It really gives the students a clear picture of the whole chart process with the data, right from when a patient checks in at the hospital and does that registration process to right up to 10, 15 years later when the destruction period has been met on that data. So definitely the fact that you can take it from anywhere in Canada, right from your home. In fact, I love that component. Like I said, I'm from Saskatchewan. A lot of my students from all over Canada, and it's a very unique learning experience that we can compare the healthcare system province to province as it is. It can certainly vary, and coverages and insurance and things like that, province to province. So to have that ability to connect with other students across the country is an amazing experience, as well as we have the ability now with our new unique design model for teaching. We do one live class per week and two pre-recorded classes, and then two lab classes per week. So we offer a lot of flexibility that isn't always possible in college classes where you have to be in person, right? We have that flexibility where you can, when you've got more time, it might be 11 o'clock at night, you can sit down and watch those recordings. That's fine. So we have that flexibility. And my goal as an instructor, and I'm sure it's quite similar to the other instructors in our faculty, but I want to provide our students a sense of community, and I want to be able to support them to achieve their career goals as well as achieve their family life and their work balance as well.
Mhm.
We're seeing more and more camps go into exciting employment opportunities, whether it's private practice, the cancer agency, workers' compensation, mental health clinics, public health, long-term care, not to mention just being a team member on a very wide variety of different analytical projects and research studies, as well as helping with the implementation of the electronic health record. Well, if you feel that you have a passion for the medical field, but you maybe don't want to be hands-on patient care, this profession could certainly be what's right for you. That was, my big question back years and years ago in high school. I wanted to be in healthcare, but I didn't really want to do the hands-on patient care. And I also had a love and still have a love for technology. So it's a great combination of healthcare and technology all in one. You can also build on your profession. Once you've got your diploma, you can go further from there in healthcare as well. So I definitely would encourage you to reach out and gain some more information on this wonderful program.